Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. Today is Thursday, January 13, 2022. As always, pleased to be here to take your COVID questions live. You can put them directly into the box below. You can also use the hashtag AskDrArwady on either Facebook or Twitter. We've been getting a lot of questions in, so as always, tried to pull together some slides to help answer some of the most frequently asked questions. But in the meantime, let's dive right into the dashboard, chi.gov/COVID-. And the biggest question that all of you have is, are we starting to see things turn around? And I want to actually talk you through what's on the dashboard, but also a little bit of what we're looking at behind the scenes. First, I want to say I am much less worried than I was even 3, 4, 5 days ago, where we had not seen signs even of some flattening. It is still too early in terms of being able to clearly say this is a peak, we're on the way down, but I think we are seeing some signs of certainly flattening across many different metrics. And I remain encouraged by what we're seeing here in Chicago and internationally, and I'm going to show you that too, because that's the biggest question that everybody has. So first of all, in terms of cases, we're averaging 5,070 cases per day. Very high, but down 7% from a week ago. And you can see that just a little bit of a downtick. In comparison, testing is up. 32,000 tests happening a day, up 2%. So it's a good sign when cases are going down at a time when testing is going up. We often look at those together. We also look at cases together with positivity, and this is especially important. As you've probably heard me talk, and some of you who have been following this closely have seen, there has been just some more intermittent technical problems with the speed that some of this data is coming in. So, for example, when there are a lot of people getting COVID tests, the labs are really, really busy. Sometimes the labs have some delay in reporting out their results. And then even running all of the tests can take a little bit longer, meaning that there is a little more variability in terms of the timing of when those reports are coming in. Similarly, the hospitals are really, really full. And if just quickly on hospitalizations, we're averaging 196 Chicagoans newly being hospitalized every day. That's been the 7-day average over the last week, and that's up 24% from a week ago. So I in no way want to suggest that this particular metric is looking beautiful, but usually first we see changes in cases and positivity and a couple of other things I'm going to show you, and then hospitalizations and deaths do tend to lag, just because when somebody gets COVID, it typically takes some time for them to be sick enough to be hospitalized or, unfortunately, go to the ICU or even die. We are averaging 20 deaths every day right now in Chicagoans, and 14, that's up 51% from 14 a day a week ago. And these, again, are what I want people to really be seeing, because the risk remains very high for people who are not vaccinated. And I'll show you that in a second, too. The great majority of the people being hospitalized and dying are unvaccinated still. And that is still what is driving most of the surge. Vaccinations are up, which is great to see. And overall, these numbers are still very, very high, but starting to see some signs of flattening. Let me show you a few other things behind the scenes that we use to track some of this. So one thing is emergency departments. We always, and some of you who have been following closely know that this is something we track behind the scenes, and it's been in as part of our metrics. It's just not on the main dashboard page. Because the percentage of people who are coming in with these kinds of symptoms who subsequently end up actually testing positive for COVID is one measure to track, as well as just how many COVID diagnoses are being made in emergency departments. This, of course, can be affected by how much testing is available. There's a lot of things that can play into it, but nevertheless, in the same way, cases and positivity are kind of an earlier indicator. Emergency departments are, because a lot of people come to the emergency department, but they're not sick enough to get hospitalized. So if, for example, the reopening metrics that we've been using, and these also get updated every day with what's happening with ICU capacity, et cetera. If you look at emergency departments, we remain in the very high risk, over red here. Our goal in an ideal world, you'd have fewer than 50 people being diagnosed with COVID as a result of emergency visits if we were in, perfect control here. And we like to see that under 200 to sort of come out of high risk. It's still very high in that we're averaging about 400 a day, but you see this nice decline. And this is one of the things that, behind the scenes, we're looking at and saying it's not, and because this is a different reporting, this is, we get this automatically. It's not through the laboratory, it's kind of through emergency departments, and there's some more behind the scenes, but again, some early signs of real progress there, which has been good. Similarly, if we look at, and you can look at what's happening with non-ICU beds here or ICU beds here, do you see how those are flattening a little bit in terms of the increase? They are definitely still increasing. And if you want to get the specific details, just as a reminder, under latest data here, if you go to hospital capacity, this gets updated every day, and this again, is directly Chicago hospitals reporting to us every day how many people are in the ICU, in the non-ICU, on ventilators, in total across the hospital, as well as a result of COVID. And so, we've got more people right now hospitalized in non-ICU with COVID in Chicago than we have ever had, going all the way back to the beginning of the pandemic. Can't say that strongly enough. 15% of the non-ICU beds available. And across the ICU, we've got 312 people in the ICU with COVID-19. I know people are asking with and of. These are people, especially once they're in the ICU, like the reason they're in the ICU and sick, they have COVID. But you see also the beginnings perhaps of a little bit of flattening there. We'll have a better sense of all of these numbers over approximately the next week or two. We still have 10% of our ICU beds available. And then ventilators also, getting close to where we were at the peak before vaccines were available. Almost all of these folks on Vaccinated. But we have plenty of ventilator capacity, but there are 159 people in Chicago hospitals right now with COVID-19. So I hope that helps answer the biggest question that some of you were having, is that yes, there are definitely signs for optimism, but just when we start to see a flattening, that does not mean we are done with surge. It means that we start to see a decline. Risk remains relatively high, especially for folks who are unvaccinated. While we come back down to the same metrics that we've been using. So too early to call, definitely, but there are multiple signs, both that you can see on the dashboard here, as well as behind the scenes, my epidemiologists do things like looking at how are the acuity numbers changing, and we are seeing flattening there in terms of how many patients are getting diagnosed and, ending up moving all the way through that cascade. Some of the wastewater surveillance, everything's Omicron at this point, which is good in terms of it moving almost everything. I should be clear. More than 90, probably 95% of what we're seeing in Chicago at this point is Omicron as the estimate. And so that's good because that's one other thing kind of behind the scenes we watch to see how quickly this virulent, this more contagious variant is spreading. All right, let me pull up some more slides just to help answer some of the other frequent things that we were getting. So first of all, in terms of our overall numbers, and again, you can track these every day yourself, but I try to pull them up on Facebook. We remain at very high transmission for cases, test positivity, and non-ICU beds. You can see, though, cases and test positivity, we are tentatively labeling those as decreasing and following. Our hospital capacity is still, the number of people hospitalized with COVID is still going up, and the ICU capacity still remains at high. I remain concerned about the hospitals, and we are talking to them every day, making sure we're doing everything we can to be as prepared and trying to offload people in any way that we can, where that is appropriate. But those are still increasing, and that's what we would expect. You see just a little more detail from the dashboard there. Average case rate is at 5,070. In December, we had 7,871. Actually, in January, we've had a couple of days with more than 8,000 cases. Test positivity, again, 18.2%. Just maybe starting to tick down a little bit, but let me just remind you, if you look back to this time last year, this peak, and we saw it come down and come back up and come down and come back up. That was technically holidays, and holidays have also influenced what we see in this space. And so each day that this continues to hold, we have more confidence around it. But there is just some slowing of how quickly some of the data is coming in, and that's part of why we have to be careful. 196, as we showed, 15% non-ICU, 10% ICU, and these are just the details, like I showed where to find on the dashboard. This has not changed, you know, we do these by age group. We post these. Vaccinated Chicagoans still so much less likely to experience severe illness, needing to be hospitalized. This red line are unvaccinated Chicagoans being admitted to the hospital, and this data was pulled January 8th, so just a couple of days old. And you see that in red there is the risk, you know, still seeing 90 hospitalizations per 100,000 people who are unvaccinated, as compared to much lower in the light blue, people who are fully vaccinated but not boosted, and then in the dark blue, boosted. And I think you're going to hear some more language as we move forward here around sort of being up to date with vaccination. What does that mean? This happens to be the kid one because I know there's a lot of interest in children. Again here, what is really surging is that line, which is 12 to 17-year-olds who are unvaccinated. Really important that adolescents, really that everybody's getting vaccinated, but especially adolescents. And I do, you know, those of you with the kids under 5, I know you're worried, and I am watching closely. We'll let you know if we have updates of when vaccine will be available for those younger children, because I know that's hard. But the good news is those youngest children least likely to have the severe outcomes, but I share your anxiety around wanting to have that vaccine available for them as soon as possible. Of course, wanting to make sure that all of the safety and efficacy data is completely done. Hospitalizations do remain low overall among children 0 to 17. You see, and it's that dark blue line on the bottom. We're seeing a lot of people in their 80s, their 70s, their 60s, again, especially unvaccinated. But there are people, of course, who have breakthrough hospitalizations, especially if they're older with underlying conditions. Here's the UK data. We are similarly starting to see a little bit of this decline in COVID-19 cases. And the time frame for both of these is about what we would expect, where we saw what was happening in South Africa. That's another thing. You know, you've heard me say, feeling pretty confident, you know, 90% that we'll peak in January, and hoping, you know, 50% that it would be in the first half of the month. And as we sort of move into the half of the month, that I wasn't just making those dates up. That's around knowing approximately what that time frame looked like in South Africa. And it's been good in the UK, similarly, to start to see, but also at a time when there are disruptions with holiday testing and travel and all things, gathering. But a little bit here, you can see the hospitalizations too. This is the UK again. Some flattening in terms of hospitalizations and people testing positive, down a little bit. So a number of signs that give us evidence for some cautious optimism, but still cautious really at this point. And we don't know how quickly, once we are clearly declining, that'll happen. It happened very fast in South Africa. So in a best case scenario, we'll see a very rapid decline. But this is where we've got a lot of people that are much older than folks in South Africa, more underlying conditions, more obesity, differing rates of vaccination, prior infection, et cetera. And so we're watching, but there are signs of this internationally too. Vaccination rates continue to increase, which is the thing that is the most important still. in terms of helping to protect Chicago. We are at almost 78% now of those over 5 having had their first dose, and almost 70% of those over 5 being fully vaccinated. Making progress on the kids every day. You can take a look on the dashboard if you want to see this. By race ethnicity, again, this is on the dashboard, but partly it's here to remind me because some of you were asking what is happening with vaccinations by race and ethnicity in Chicago. So this is the whole population. It would include children who are too young to be vaccinated. But where we look at vaccination rates by race ethnicity for the whole population, you see that among Asian non-Latinx Chicagoans, about 81% have had a first dose and about 73% are fully vaccinated. That is the most vaccinated group by race ethnicity. And when we look at Black Chicagoans, the least vaccinated group. So 57% now of Black Chicagoans have had a first dose, and just over 50% are fully vaccinated. So glad to be able to say the majority of our major race ethnicity groups have now had the most important protection, but clearly there is more room for improvement and vaccination, particularly in Black non-Latinx communities. I'd gotten a question about Latinx, and I wanted to help you kind of understand the difference. We have a lot of Latino children in Chicago, including a lot of very young Latino children who are too young to be vaccinated yet. So these comparisons, and the reason they're done like this is there's some things about the way the census data comes and how you have to divide it up. But when you're dividing by race ethnicity, you are looking at sort of the full population. And we actually, if you see, Latinx Chicagoans' whole population, 69% have had a first dose, 61% fully vaccinated. If you look at white non-Latinx Chicagoans, it's about 74%. But where you correct that for age, adult Latino Chicagoans are essentially as likely to have been vaccinated as white adult Chicagoans. We're seeing the comparison here lag just because there's a lot of kids and there's more room to go on boosters and plenty to do in that group. But it is really good to see that progress. And some of the gap between the first and second doses has to do with kids, where there's always going to be 3 weeks between children getting vaccinated. So lots of room still to go, but I did want to take a minute and share that most recent data. And you can follow this every day. It gets updated online. Also, since Thanksgiving, we've really seen nice first dose COVID-19 vaccine uptake among Black and Latinx Chicagoans to this point. These use the same colors, and so just since Thanksgiving here, and this is not just did anybody get a vaccine, a booster. This is a first dose of COVID vaccine, and it makes me very happy for these numbers in particular to go up. And so these are our daily averages, and you can see that that we are making the most progress among Latinx and Black Chicagoans, which is great. But regardless of anybody's race ethnicity, I'm always thrilled to see these numbers where they are, and we've seen them tick up for all race ethnicities, and I'm glad about that. Some questions about masks. And we did distribute these KN95 masks as well as information, and we'll take some more specific questions. But I wanted to just highlight that it's been really great to see people getting these out. So the team here just took a sample of what some of the aldermanic offices are doing. We got a question from somebody, did all of the aldermanic offices get KN95s? I'm trying to see who asked that. Take TK on Twitter. Did all aldermanic offices receive KN95 masks? Yes. Each one received 20,000 masks, and then he's asking, did all schools? So schools, remember, have a separate process. We did make 200,000 available right at the beginning of the week, so they were there for CPS in particular. But schools it is a separate distribution process through schools. But yes, schools broadly have KN95s available, and CPS definitely does. But these are really meant for community, and so aldermen are welcome, and we encourage them. They can do them from their office. They can distribute it. They know their wards best, and so if some of them are wanting to distribute to churches, to other religious organizations, to community organizations, to food banks, et cetera. We continue to do other work behind the scenes in terms of making sure the highest risk settings continue to get masks. But importantly, we wanted these out fast, and so we worked with all of the aldermanic offices, and then in addition, there's 100 or so community-based organizations. These are the same ones that have all along been helping with cloth mask distribution early on, with helping, they're the ones who we work with. It's a wide variety if people are interested. Once these are all out, because today and tomorrow are the last days of pickup, we can share out, the details of who is doing that. But then in turn, we've asked them to prioritize the highest need settings. And nice to see that happen. This again is a one-time. It's not an ongoing. It's right now in Omicron doing an extra push around this, and the CDC has not changed, is not likely to change the recommendation, and I'm guessing there will be more mask questions, which I will take. One additional question was about, can I reuse them? And we've got a little graph here, and this is where things can be specific. So in a clinical setting, like when I am in clinic seeing a patient who's coughing and has a fever and very well may have COVID, I am of course going to be keeping my N95 mask on all the time. That's a high risk setting. And there are, depending on the exact type of mask, there are sometimes recommendations for single use or an amount of time, et cetera, in clinical settings, meaning in hospitals, in clinics. But in the community, they absolutely can be reused, and they can be reused for an extended period of time, but not forever, and I wanted to help people understand this. So first of all, for any mask, it is the most important thing to make sure it is well fitted to your face. I don't want you thinking, I'm putting this, I got a KN95, but it feels really uncomfortable, it's hanging off my chin, it's an adult one and my kid's trying to wear it, it's a kid one and an adult's trying to wear it. No. If it doesn't fit your face well, don't wear it. Number one. Number two, this should be true whenever you're doing masks for everybody. I know not everybody always does this, I among them, but really the recommendation is to perform hand hygiene before putting on or taking off any mask or face covering. Whether that's washing your hands, whether that's using hand sanitizer, it helps keep germs off the mask. It helps remind you to wash your hands. And so I would again remind you to be doing that. Do not attempt to wash KN95s. Don't throw them in the washing machine. Don't try to wash them in the sink. To keep it clean between uses, you can store it even just in a dry paper bag. I do have one that I sort of keep in my pocket, but I keep it in the bag. I don't wear a KN95 the huge majority of the time. I have it there if I'm in an airport, for example, or I'm somewhere that feels very uncontrolled in terms of a crowd, et cetera. But I also try to avoid those situations right now. But even like when I'm at work, I'm wearing a surgical mask with a cloth mask over top of it in terms of what I can keep on all day. The most important things all of these do is keep your germs to yourself. And then finally, when to discard your mask. You got to discard your mask. And honestly, this goes not just for KN95s, but for any of your masks. Discard your mask if it is soiled. Time to throw it away. Or wash it if it's a cloth mask. But soiled, throw it away if it's a surgical mask or KN95 mask. If it is damaged, throw it away. If it becomes stretched out, throw it away. If it no longer covers your nose and your mouth, throw it away. If it cannot stay on your face or it is hard to breathe through, those are all reasons when you need to stop using the mask. Otherwise, being careful around them and then storing them in between uses in dry paper bag is as much about, not if there has been exposure to COVID, giving it the chance to sort of air out and dry out again. And it's not like the N95s magically after a certain number of hours stop protecting. It's just that they are not forever. And so I hope that helps. And then we'd gotten a number of questions about what's happening with CDPH's COVID vaccine clinics. So first of all, CDPH continues to offer, we have bricks and mortar sites that are our immunization clinics that we vaccinate out of. Those are open, those aren't going anywhere. But we also have stood up these weekend vaccine clinics, and given the demand we're seeing, we're doing another whole round of them with city colleges. So here's the details. We'll be at Richard J. Daley College, Saturdays 9 to 2, January 22 and February 12th, Wilbur Wright, that Sunday, and then going on from there. So those are the details. You can register. There's the website. If you go to chi.gov/COVIDVax, you'll find it. Or if you need help registering, give us a call. Focus here, kids or adults or boosters. Focus is really on Pfizer. And then finally, a positive test is positive. No matter what kind of test or where it needs to be done, there is no need to repeat tests. Some of you have been writing into me saying, I had 7 tests within 3 days and 6 of them are positive, and what about this? And please, one test is positive. Treat it as a positive, stay home, minimum of 5 days, assuming that you're feeling better after that point. Wear a mask, be extra cautious for the 5 days after that. And then it is the final deadline this weekend to enroll in health coverage through the federal marketplace. So by Saturday, if you are someone or you know someone who does not have health insurance, this Saturday's it at midnight. So go to healthcare.gov or cuidadodesalud.gov or call 1-800-318-2596. There are health plans on here that you can buy for people who are low income. There are health care plans that are very inexpensive and even free. So otherwise, you can't sign up for the marketplace otherwise unless you have a change in your job status or something else that changes your insurance. So that's an important deadline, and please share the word. And then, as always, you have questions or boosters, chi.gov/COVIDVax or 312-746-4835. All right, hope that answers some of your questions, and let's get into some more of the new ones coming in. Okay, lots of things here. So first of all, there's a number of booster questions. Let's do those real quick. So Alfonso Gianfrancisco on Facebook, I see, says, I tested positive for COVID 14 days ago. I'm vaccinated but didn't get the booster. When can I get it? Good question, Alfonso. Thank you for getting vaccinated. Thank you for getting vaccinated. My guess is because you're fully vaccinated, hopefully you didn't have a severe outcome, etc. Nevertheless, you can get the booster right now. The recommendation for people to get a booster is that we don't want you to get a booster during the time you are potentially infectious for COVID. So if you have been diagnosed with COVID, you get a positive test, any test, please, for those next 10 days, I want you laying low. But if it's been 10 days since you were diagnosed with COVID, you can get any of the COVID vaccines, including a COVID booster. So go ahead and get it now. And I would encourage you to do that. Your chances of getting seriously ill if you're vaccinated and you've had a recently test, they're relatively low. But that booster certainly helps add to that. We are a long way from being out of this surge, regardless of whether that peak is fully there, variants to come, etc. I absolutely continue to recommend people to get that booster now. And that's what I tell my own family and friends. Laura Catherine on Facebook. Do I have news on a 4th shot, 2nd booster? No. I will I am not at this point, there's no recommendation from the CDC, from the state health department, from the local health department, from anybody to be going out there and vaccinating yourself over and over again. And again, why do we make the recommendations we make? We make them based on data. We make them based on seeing, for example, with this last surge with Omicron, there were big studies that were done that showed, for example, people who had been vaccinated with 2 Pfizer doses more than 6 months ago, we saw in the study that their protection had gone down for infection, okay? Now, hospitalization has stayed quite good. But for infection, we saw it go from like a 70–80% protection in some settings in this surge down to like a 30% protection. Is that still protection? It is. You're still 30% more protected than people who are not vaccinated, but a big drop there. They saw with a booster that came right back up to like 70. It went from like 75–80 down to like 30, and then with a booster it came back up to like 70 or so. And then with hospitalizations, like that data that I showed you, the booster even further drops your risk of severe outcome. But we don't have data saying that there's a need to kind of keep doing this, keep doing this, keep doing this. Where you might be getting confused about this, or where people are perhaps sharing information that is not meant broadly, there remain a few people, much less than, I mean, like 1 in 100 people, not even probably, who really have like some kind of severe immunocompromise. They are receiving chemotherapy for cancer. They have some kind of rheumatologic condition where they take medication that is meant to suppress their immune system. And some of those folks, they just don't have as much of a response, a protective response after vaccination. And so there may be, there are individuals working with their doctors, and this is just not like I'm worried about my immune system or I have diabetes. No, this is like I have a specialist who worries about my immune system. I'm known to have an immune problem. For those people, I want you talking to your doctor, because there may be other recommendations around what's happening with your antibodies or boosters, et cetera. But for the general population, and that includes people with underlying conditions, that includes people of all ages, that includes everybody, I want you to get your initial vaccine series, and I want you to get a booster. Can I predict what we will be doing in 6 months or a year? Not entirely. But I can say right now, there is no need to be doing more than that based on what we see on the data. We've got to get the world vaccinated. It hasn't been studied to do, et cetera, et cetera, et cetera. And these vaccines continue to perform amazingly well at keeping people protected from serious outcome. So get the booster, but don't keep getting more. And we'll let you know sort of as we learn more about this. Where you think about flu, every year there is a flu vaccine. Why is that? Because there are a lot of variants, if you will. We call them strains, but they're like variants of flu that are circulating. And every year you're sampling and saying, okay, in the southern hemisphere's winter, these were the variants, the strains that were the strongest, and we're gonna make a new flu vaccine for this year. But will we be at a point of having to do that for COVID? We might. Are we there now? No. Might it be something where there is an annual? There might be. Is there now? No. But right now, with 20 people dying a day from COVID right here in Chicago and growing, and almost 200 people right here in Chicago every day getting newly hospitalized with COVID and growing, get the vaccine now and get the booster now. And to Edith Martinez on Facebook says, good morning. I would like to know if you can get coronavirus after being vaccinated. I just received my booster. Yes, you can. The vaccine has never been it's never given what we call sterilizing immunity, as in like you have gotten something that says you will absolutely never, ever, ever get the disease. If you think about it, the very beginning, I was thrilled those first vaccine trials that came out and showed that people before all the variants were, 95% protected. I mean, that is an amazingly effective vaccine, but it is not 100%. And actually, we don't really have vaccines that are 100%. But what we've seen is that as the virus has continued to evolve and mutate and have different variants, that protection with vaccines against infection, against ever getting a positive test, has been dropping. If you are vaccinated, are you less likely to be diagnosed with COVID than if you are not? Yes. Getting vaccinated helps protect you even from getting infected. It's about, here in Chicago, where we look at the most recent data, people about twice as likely to be infected if they're unvaccinated versus vaxxed. But is it possible to have a breakthrough? Yes, and we're seeing a lot of them right now. Many of these people are getting very mild illness, especially if they don't have a lot of underlying conditions. But that's why it's important right now that anybody who is having a, if you remember the very beginning of COVID, the first thing, even before we did stay at home, even before we did anything, the first piece of advice, the first emergency order passed at the city of Chicago was in legal language. If you are sick, even a little bit sick, stay home. Right now in this surge, this is basically, if you are sick and unvaccinated, you probably have COVID. If you are sick and vaccinated, it's COVID until proven otherwise. Stay home, you need to get a test, basically. But most of the infections that we're seeing, if you are someone who just got your booster, you might get COVID, and you should continue to be careful. Right now, with this surge, you should be wearing your masks, you should be not taking unnecessary risks, but your chances of getting seriously ill are very low, and that's sort of, what part of why this has been confusing for people is that's been the split. A number of you were writing in saying, what do you mean the vaccine can't prevent transmission? It can't prevent transmission entirely. Is it the best thing you could do to limit transmission? It is. And when somebody has been diagnosed with COVID, they themselves are vaccinated and boosted, and everybody around them is vaccinated and boosted, we don't see a lot of, frankly, we sometimes see spread, for sure. I don't want to say that we don't, but a lot of times, I got the other version of the question too. Is it possible to not spread COVID if I get it and I've been vaccinated and boosted? Yes, and in fact, we don't see it happening all the time, but it is happening. So it's important, even if you're vaccinated and boosted. First of all, if you get a positive test, it's positive. It's COVID. Even if you're feeling fine, you need to stay home a minimum of 5 days and watch for 5 days after that. And if you are not sure and you can't get a test and you're not feeling well and you're waiting for a test to come back, it is COVID until you have a test result back proving otherwise. Okay. And Frank Christian, I see you asking, and that's part of why I addressed that. He's saying, over the weekend, CDC Director Dr. Walensky said what vaccines can't do is prevent transmission. And that's where it doesn't 100% prevent transmission. It does cut the risk of transmission, but importantly, it majorly cuts the risk of serious illness. And if we can turn COVID into a disease that does not put untoward number of people in the hospital and how, all of these deaths. And if we, as the medications continue to develop, where people have underlying conditions and are older, and if they get a breakthrough, there's a medication that helps keep them out of the hospital. Like, this is how we tame COVID. And so to the second part of your question, can you explain why mandating vaccines to enter bars, restaurants, and gyms is effective for slowing transmission? Thank you. Number one, remember, you have to get COVID to spread COVID. Being vaccinated does cut the risk of getting COVID. It also, when you have fewer symptoms, less time, the amount of time that you may be infectious is less. And so it is true that the risk, quote, of spread is lower. But more to the point, settings, bars, restaurants, gyms are high-risk settings for COVID transmission. They're settings where you're taking off your mask in the restaurant, by definition. In what we have, if you actually look at the details, the sports settings where you have to do that are where food and drink is being served and you're having to take a mask. And right now, knowing that unvaccinated people are the ones, by and large, that are filling up the hospitals in Chicago, knowing that these are the highest risk settings, different than schools, different than workplaces, different than places that have put mitigations in place. These are just higher risk settings. It is important in terms of controlling the outbreak, but also protecting our hospitals, that highest risk settings, while we are in this big surge, the risk is just too high of matching a high-risk setting with an unvaccinated person. And so that's the reason. It is not a forever thing. Once our numbers, get back down, like last summer when we were at low or even that moderate risk, either level 1 or level 2 from CDC, we won't need to be wearing the masks. We won't need to be doing the vaccine requirements. But right now, while things are high, we have to. What am I trying to do? Not have everything have to entirely shut down, right? And keeping higher risk settings open also means doing what we can to limit risk in those settings. And right now, that does include folks who are unvaccinated. Okay, lots of questions about testing at home. So let's try to get a few of these in. So Reynonda Townsend on Facebook says, with people now testing at home, how will this affect the accuracy of the positivity rate? Good question. I've talked about this a little bit. So approximately half of the tests that are being done across the whole US are now being done at home. And number one, we've been tracking sort of what do those numbers look like. Now, when you know, there was this period as Omicron started to come that it became much harder to get at-home tests. And so you see some variance there. But the good news is that we know that so there's a few things that we know. Number one, there are some people who report at-home tests. Not a lot of them, but there are some. There's QR codes on some of them. You can also you should, if you get a positive test, be letting your doctor know, et cetera. But most people, especially if they get a negative, do not ever report that, right? I take negative tests. I take COVID rapid tests at home. I took one today. It was negative. I did not do anything to report that. This means that people who take tests at home, we are more likely to get them reported if they are positive, which actually can affect the positivity rate. But mostly, they're just not counted. The reason I talked at the beginning about the way that tests are moving with positivity, if you're seeing cases, positive tests go down and positivity go up, or you're seeing positivity go down and cases go up, that is not suggesting anything serious about the way the outbreak is going. It's suggesting changes in testing that make it hard to interpret that. Part of the reason we also look at emergency departments and everything else behind the scenes is that those have been more stable throughout, because everybody getting admitted to the hospital, from the beginning with COVID symptoms has had a test for COVID, right? Everyone who has died with potential COVID symptoms, you get a test for COVID. Like those have been very consistent. But we don't need to count every case. And that's where I talked on Tuesday a little bit about this. We are following behind the scenes a lot of how we track what happens with other infectious diseases. And I think as we sort of move through this surge and things start to settle, we will probably be tracking some of this more like we track the flu. So yes, don't worry if your individual test is not being reported at the population level. We have all the information we need to know what's happening. And at the individual level, I love home tests because it lets you know on the spot what your risk is, right? If you are not sure and you can take a test, it does give some extra peace of mind. But also it's important that if somebody has an underlying condition, quickly being able to have a rapid test, remember a positive is a positive, lets you more quickly connect to your doctor, or potentially more quickly connect to some of the medications and the viral antivirals that can help keep you out of the hospital. So there's a number of reasons, and I talked on Tuesday quite a bit about how we are prioritizing making sure there's rapid test access. And our federally qualified health centers are actually the first place that the federal government is making sure have access to this, because we know that that's where we can also link to some of the care. In addition, of course, also the hospitals, the people who treat people with immunocompromised underlying condition, long-term care facilities, et cetera. And so Shannon Holman, are the numbers declining because they're taking at-home tests and the results are not being reported? No, if that were happening, if all of a sudden everybody had stopped reporting, what you would see is positivity skyrocketing and number of tests going down, okay? So this is part of why you have to look at these together. If the whole world decided to test all of, magically, immediately I could test everybody all at once, and I was testing the entire population of the city of Chicago on one day, my positivity would be very low, but my cases would be very high, right? So it's seeing these two move together always that helps us sort of understand how changes in testing influence the changes in cases. So remember, what is positivity? It is just the percentage of reported cases that are positive. So rest assured that we're watching that. Mary Rodriguez on Facebook. I've been seeing it might be good to swab your throat for an antigen test. Is this a thing? Seems like it wouldn't be good to swab the throat and then bring oral bacteria into the nose. Okay, good question. All of the antigen tests have been tested, authorized, sampled, manufactured for nasal use here in the US. And you should always follow the directions that when the FDA gives the authorization, et cetera. Those of you who have seen an at-home test know they come with instructions, and I buy these myself because I like to see what's coming out, and I've had all different versions of the details of the liquid and where it goes and how you do it. You got to follow those directions. But no, I would not recommend swabbing throats. Where this came from, there was a lab study At this point, there's more research being done. So we knew with Delta, there were a number of studies that showed actually that nasal swabs were more sensitive than oral swabs for COVID. They were still both very, very good, but you were actually more likely with Delta with a nasal swab, all things considered, than an oral or a throat swab. There's like a lab study or two that say maybe the oral, is it replicating more in oral than it is nose? But that is just a lab study that has not been shown, and that is not how those kits are manufactured. So please do not be swabbing your nose and then your throat and your nose or just your throat and trying to do it. The swabs are designed for nose. They are deep. I don't want you trying to take the one that's short for your nose and don't do that. Use the test, any test that you have, in the way it is meant to be used. And you won't find a single person, even I've been following this online, and even the scientists who were sharing, some of this preliminary data that needs to be looked at, not just in the lab, but in people, and needs to be replicated, and they'll continue to study it. They even say, do not be trying to use nasal swabs for, doing your throat. So no, keep using tests the way that they are indicated, no matter what kind of test it is. Okay. So I don't usually take the individual level questions, but Diane, I think this is a good one. Diane Eberl on Facebook says, my dad is 98 and lives at home. He is vaccinated, but not yet had a booster. My sister developed cold symptoms last week, Tuesday, so she is staying away. Agree. His caregiver informed me today he didn't have much appetite for breakfast. He has a slight congestion. Should he be given a home test? He is not running a fever. Okay, so a couple things on this. Number one, very, very glad, obviously, your 98-year-old father is fully vaccinated. We would definitely like to get him a booster. If you call 312-746-4835, we will send a booster to his house. We will send a Pfizer booster, which is a good booster, regardless of what his initial vaccines was, and we should get him that. And we do extra testing. We make sure that the folks who we are sending into homes, are not spreading COVID, et cetera. They're all vaccinated. So number one, let's get him a booster. So get online, chai.gov/COVIDvax, or make that call, and let's get something scheduled. It won't be today. It might be next week or possibly even the week after, depending, but let's get that scheduled. And then secondly, I think if you are able to access an at-home test for him, this would be a good setting to do one. The number one most important thing I heard in there is he's vaccinated. That right there takes my level of concern way, way down. That's the most important thing. And number two, that you've got a sister, somebody who's got some symptoms, and so abundance of caution, she is staying away. And that is what we want people to do, especially if there's people who are older, serious underlying conditions. It's not the time for sort of taking chances. It doesn't sound like he's, particularly sick right now, which is good. Could he have COVID? He could. If you're able to access an at-home test, that's a possibility. If you call our number again, they can help figure out some of the testing stuff, but also I would give his doctor a call, frankly. And this is always my advice where there are people who are really older, have a lot of underlying conditions, just around what to do with there. He doesn't have a fever, that's a good sign. I'm not at all saying he has COVID. I don't know who's been in and out of the home. But this is the sort of population where if you're able to, and as this becomes available and the feds roll it out, I'm excited. We have some availability for very high-risk people to link up to some testing. And again, if you're calling our number and there's particular situations, especially folks who are homebound, we have some ways to figure that out. But most important thing is anybody who's unwell is staying away, and you keep a close eye on him. And if he gets more ill, don't hesitate to reach out. And if you can get an at-home test and he can take it, and it's positive, treat it as a positive, talk to his doctor. Does he need to, try to get an antiviral, for example, in the meantime? Juanita Arroyo on Facebook. Question of what to do when the 10-minute test is positive and the PCR is negative. A positive is a positive is a positive is a positive. There's a lot of, more often we see it go the other way, frankly, because the PCR is more sensitive. And so, you know, I have some questions a little bit about that. I don't know if those are taken at the exact same time. I don't know if they're taken at the same location. I don't know if, right, there's all sorts of details that may be behind this. But right now, how good a test is, it matters when you take it in the infection, but also there's something called the positive predictive value of a test, which means there is always a low level of false positives and false negatives for any test that we do. These are excellent tests. They do not have high false positives or false negatives. But it's not just about the test, it's about what's happening in the population. So if you have an extremely rare disease, like when we screen newborns for really, really rare genetic diseases, it is not very uncommon for us to get false positives there. And if you get a false positive, you say, I gotta follow that up and repeat it, because chances are good, because the disease is really rare, that's a false positive. Similarly, a false negative, in a situation where a disease is very prevalent, which it is right now in Chicago, what's called the positive predictive value of those tests goes way up. So right now, maybe not forever when things are low, right now, a positive is a positive is a positive. And I don't want you trying to, you know, this one, treat it as a positive, please, especially if you have symptoms. If you have symptoms, no question about it. If you don't have symptoms, they both came back at the exact same moment. The PCR is more sensitive, but like, I don't want you messing around. A positive is a positive, and any positive test right now, chances are very good it's a true positive, and I want you to stay home, minimum of 5 days, and there's more information on the website if you have it. Kiki P on Facebook says, I couldn't find an at-home test in Chicago. I went to lots of stores, get tests for Chicago. Oh, I'm trying. So this is, again, as a reminder, you know, they do continue to come in. Yesterday, I was at a 7-Eleven, and you know what? They had rapid tests there. And, you know, they come in, but they fly off the shelves just as fast as they come in. And supply is low right now. This is because the federal government made a decision, which I think is a good decision, to actually centralize distribution of testing. This had been left to the market, honestly. And what we saw is a big drop-off in the production of rapid tests when cases were low, as opposed to sort of the government saying we're going to commit to purchasing these even if they end up expiring, right? And there are reasons to do this that go beyond, you know, that makes this different. And so CDPH used to get rapid tests. You know, we order them, we've been buying them all along. We've distributed, I don't know, 150,000 in community, plus more in the sites that we've needed to. We do have the ability where people are, when we're doing our case investigation and contact tracing, or when there are particular settings where people can't leave home, we have some ability to direct some tests to them. But at the population level, as of November, even CDPH, unable to get rapid tests because the feds are setting up the distribution of these nationally. So supposedly within just a week or two, this is going to be like, I can click on one website from the federal government and a test will get sent to my house, or multiple tests. This is already, they've started, and I believe this because just this week, you know, we started seeing them start to flow into clinical settings again, because even more than this at home, you know, this 98-year-old at home wondering about a test, I want to make sure my clinical settings, you know, if someone is coming in, I want them to be able to rapidly know if somebody is positive, to be able to act on that, right? So getting it into our clinical settings is the most important thing. But they've invoked the Defense for Production Act, which means they're getting produced in the zillions, and apparently 500 million are going to be sort of available for distribution soon. So I continue, just so you know, to order them myself off Amazon. It's taking like I ordered some more, I think, yesterday, and I think they said they would deliver them in a week and a half. But I do keep ordering them. They can be reimbursed through insurance. You can use your FA, if you have resources, you can use your FSA, your HSA, you know, your various health savings accounts. Also, as of the 15th, federally, they said that insurance companies cover the cost of these. So save your receipts if you buy them. But they are hard to find, and I know that, and that is part of why what I really don't want is people going and taking, you know, a ton of tests, especially outside the home if they've had if they have been able to access one at home. So. I think there's 150,000 that are coming into the clinical settings over kind of this next week and a half. We're working on getting them into long-term cares, et cetera, and I do expect it to open up some more again soon. But this is Omicron. The whole world is wanting this, and I know it's hard when you can't get them. I have made a point never to use a test procured by the Chicago Department of Public Health for my own testing, because I believe in number one, every day I pretend I want to get a vaccine or a booster, and I go online and I look to see, okay, perfect, I can get a booster, you know, today down the street, I can get this. Like I am very interested in sort of what is the experience of a regular Chicagoan in accessing testing and accessing vaccine. Last week with the schools, for example, you know, this was a big point of contention. It's not that there's money, it's that there's not necessarily tests. And so as the testing supply ramps up, you know, there have been some rapid tests made available for CPS, which I think is great. We have to pair that with making sure clinical settings, you know, especially are getting it, and this is going to ease really in the next couple of weeks. But in the meantime, keep your eyes open, because you'd be surprised where sometimes you're like, oh, like they've got COVID tests, and I do buy one pack of them when I see them. All right, we are basically at time here. Let me just a couple quick last questions. Sammy Carrillo on Facebook. Are 5 to 11-year-olds able to get a booster? No, but they don't need to. Remember, who gets a booster? 5 months after getting your first vaccines. If you got Moderna or Pfizer, 2 months after getting your first vaccine if you got J&J. All the kids get Pfizer. It has not been 5 months since 5 to 11-year-olds got their first and second doses of Pfizer. So 5 to 11-year-olds are good. They are entirely up to date with vaccine, and they do not need a booster, but they should get those first and second doses of vaccine. 12 and up, though, eligible for boosters, recommended for boosters. If it's been 5 months and you are over the age of 12, strongly recommend you get that booster. There's lots of places to do that, as we discussed. Phase state from Facebook. Are number of cases still available by zip code? Yes. Right on the dashboard there, you can see what's happening with cases, positivity, vaccination. We update that every single day. We're really committed to it. So check out, you know, on the top of the dashboard there where you click across, you go cases, and then it goes cases by zip. Vaccines by zip. And in the cases tab is where you can look at race, ethnicity, and all these things. And in the zip code is where you can see what's happening in your zip code. Know that testing patterns are different in different zip codes. So to the same point, you want to look at, if we've got a zip code that has a lot of positives, you want to see what the positivity rate is there. You really want to look at those together right now. But yes, that's available. And then Bob Fisher from Facebook. Do the over-the-counter tests expire? I have some I bought last year, just wondering if they are still good. They will have an expiration date on them. So take a look at the box, and that will give you the answer. There were some extensions of expiration dates early on. So if you really want to explore, you can go online and look it up. But broadly speaking, they've got a date of expiration on them, and I would just encourage you to use that date. And with that, let me just, oops, sorry. For some reason, the computer has frozen. So we will, I think, just have to end with that, because for some reason, my computer has decided to stop scrolling. But that means, presumably that's because a lot of you continue to put in really good questions. So we will come back and get those next week on Tuesday. And in the meantime, stay safe. We will be watching that data really closely. I know those of you who have been following closely along, my data nerds, will also be looking at what happens in terms of projections going forward. And we'll have a much better sense of how well this is holding by next Tuesday. So have a lovely weekend. It's Martin Luther King Day. Tomorrow is the city at 9 a.m. Streaming the interfaith Martin Luther King celebration and conversation, and I encourage you to watch that. It's on chicago.gov/live, and it'll be available afterwards. Rosalind Brewer, who is the CEO of Walgreens, is the primary speaker there, and they're recognizing some others. So do take a look at that, and I wish you all a safe and happy weekend. Bye-bye.